Lots of issues to discuss with Dr. Rochelle Walensky, the director of the CDC. Dr. Walensky, good morning. It's good to see you again.
Good morning, Savannah. Glad to be with you.
Let's talk about the J&J vaccine first, because tomorrow that advisory panel meets. Do you expect the J&J vaccine to resume in this country, and how soon, if so?
It's a really good question. I don't want to get ahead of the advisory committee tomorrow's meeting. They're meeting from 11 to 5, and they will see data on the new cases that may have come in since the 6 cases that were initially reported. They're also going to review data that we will be providing them on the risk and benefit analysis, the benefits of having a J&J vaccine versus the very, very rare events that we have detected. So I will look to their guidance. I believe it's really important to make a swift decision, as I believe does the FDA. So we'll see what they have to say, and we'll be forward with a guidance soon thereafter.
Just one thing real quickly. I mean, European regulators have already resumed J&J or recommended resuming J&J in Europe. Do you feel an urgency here?
Yes, I do. We need to make a decision quickly, and I'm really hopeful that we'll be able to use the vaccine soon.
All right. Let's talk about the vaccine rollout. We hit a major milestone, 200 million shots in arms. 25% of the country is vaccinated. That's the good news. But the experts are warning now that we are about to hit this moment where demand is no longer outstripping supply. In other words, you're going to have people who don't really want the vaccine, and you've got about half the population vaccinated at that point. So what is the plan to try to get the other half of the country vaccinated? I almost think about it as a race where the last half of the marathon is all uphill.
Yeah, we've been planning for this. We knew at some point, and I would consider it good news, that we have enough vaccine out there and it's accessible enough. We have vaccine now within 5 miles of 90% of Americans. And we knew we were going to hit this point. We thought it would be around the late part of April, and here we are. And now comes the hard work of working with our community core, trying to understand why people might be hesitant. Is it the science that they feel was rushed? We know 100,000 people were enrolled in these clinical trials for these vaccines. Is it that they just haven't reached messaging from a trusted messenger? So that's the work that we have ongoing. That's the work that we're doing, and we know we have it ahead.
And the goal here is, of course, herd immunity, and experts differ about at what point we reach herd immunity. It's 70% of the population, 80%, 90%, whatever it is. The goal is if you have herd immunity, then the virus can't continue to spread and mutate, which, of course, poses a big danger. Do you have any concern that we simply won't be able to achieve herd immunity in this country?
This value of herd immunity is very much dependent on how transmissible the virus is. And with these variants, that may, in fact, be a moving target. Here's what I do know. I know the more the population gets vaccinated, the more people we have vaccinated, the less transmission will happen. And so I'm rather looking toward a singular numerical target. My job now is to make sure that every American knows that this vaccine is available to them, that it is safe, that it is effective, and that they should go and get vaccinated.
Well, let me pick up on that, because that issue of transmission, whether vaccinated people can nevertheless still transmit the virus, is one of the big open questions of the pandemic right now. And it's a key one. That's why vaccinated people are still wearing masks, because we just don't know if they're able to transmit the virus. So my question is, what is the science telling you now? I know the CDC and researchers are studying it. When might we have an answer? It seems like a particularly key question.
It is a really important question that we're following. And there are numerous studies now that are starting to emerge that give us important data. So we know that the vaccine in real world studies is somewhere between 85–95% effective. And some of the questions are, does that mean that that you're not getting sick or you're not getting the virus? And people, the MMWR released data about a month ago that demonstrated that with screening, we're actually finding that people are not getting the virus at all. So what about those people who are breakthrough, who do get the virus? And increasingly, data suggests that about a third of them even if they get the virus, are completely asymptomatic, and many of them have such low virus that they can't transmit to others. Now, we still need more data in this area, but increasingly we're getting more and more data that suggests that even those breakthrough infections may be less symptomatic and less likely to transmit.
Which is good news, but just to bottom line it, when might you really have a definitive answer so you could tell people, hey, if you have the vaccine, you don't really need to wear that mask anymore?
Well, you know, what I will say is no vaccine is perfect. And so ultimately, this is going to be a matter of risk. But what I can say is a 95% effective vaccine is extraordinarily effective. If we can have a 95% effective vaccine and we can get our caseloads down, then we'll be in really good shape as a country.
And then real quickly, there's a growing debate now about to mask or not to mask when you're outside. I looked at the CDC guidance this morning, and forgive me, I choose this word carefully, it's a little mushy. Do you think that if you are outside and not close to people, you still need to wear a mask?
You know, this is a question that we're looking at. One of the things I think that's really important to understand is while there's wonderful news and we're getting more and more people vaccinated every single day, we still had 57,000 cases of COVID yesterday. We still had 733 deaths. And so while we are really trying to scale up vaccination, we have this complex message that we still have hotspots in this country. And we will be looking at the outdoor masking question, but it's also in the context of the fact that we still have people who are dying of COVID.
And really quickly, and I understand this is really complicated, but if people are getting vaccinated, but they still have to wear masks, they're outside in the fresh air and the warm weather, but the CDC is still saying, well, you should probably wear your mask. What's the incentive? I mean, isn't part of this sort of a reward thing where do the right thing and you'll be rewarded? Do you balance that at all when you're making these decisions about the guidance that you give?
We absolutely do. And as we look at this guidance to revive the guidance of what you can do when you're vaccinated, that will be easier and easier to do as more and more people get vaccinated. Absolutely.
CDC Director Dr. Rochelle Walensky, thank you as always. Appreciate your time.
Thanks for having me.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.